Hey guys, I'm gonna do my med presentation here quick. I went ahead and decided to do Narcan. I know a lot of us are familiar with it, but I think it's really important to understand it just because it's becoming more and more prevalent today with the amount of overdoses and the way things are in our wonderful world. During my presentation, I'm going to go a little bit into the background of Narcan. We're going to talk about the dosages and routes. We're going to talk about how Narcan works. We're going to talk about a few statistics, side effects, and then the last is the final comment. I wanted to start my presentation out by this saying, it says, wherever the art of medicine is loved, there's also love of humanity. That was stated by Hippocrates. A little background on Narcan. Narcan was created in 1961 by Jack Fisherman and Mox's Lowenstein to treat opioid toxicity. Can't talk today. Um, Narcan was not available over the counter until recently, September 2023. It was made readily available to anybody. You can go into your local pharmacy and just pick up some. Typically, the cost of that is $50 or lower. You generally get 2 doses via nasal spray. Dosage wise for Narcan typically is between zero point 0.4 to 2 milligrams PRN. You can give give that every 5 minutes. 10 milligrams is the total max dosage allowed per protocols. It can be given several different ways, also known as routes. It can be given IB, IM, as well as IN. It can normally is used, in people that are in severe respiratory distress due to the opioid. Um, Onset is approximately 2 minutes via IV, 2 to 10 minutes IM or IN. The duration once it reaches the onset is approximately 30 to 60 minutes. That is going to vary some depending on your person and their metabolism and how fast the body metabolizes the actual drug. How does Narcan work? Um, Narcan works by turning on the nerve cells in your brain that are called opioid receptors. The opioid receptors is what blocks pain. Narcan basically attaches to those receptors so that the opioids can't. In some cases, it actually can kick the opioid out of the receptors. It's kind of easy to explain as far as like, I don't know if you guys just have those toys where you put the different shapes in the different holes. It kind of works like that. Each receptor has almost like a key, and the Narcan goes in, fills that spot so that the opioid, the heroin, whatever your opioid, the overdosed one cannot. The only contraindication typically with Narcan is a hypersensitivity to the drug. The only way they would know that is if they had used it before and had a reaction previously. Here's a few statistics on drug overdoses in Narcan. In the United States, there have been over 100,000 individuals die from overdose. Um, Over the past few years, they said there has been about a 10% decrease in overdoses. Narcan, I know, did some research. They said in 2023, it was estimated that 22 million doses were given out free to the public through interest groups as well as other organizations. And the most affected age group for opioid addiction, 3/4 of the overdoses were known to be in adult men between the ages of 18 to 34 that were Caucasian. Symptoms of opioid overdose would be pinpoint pupils, unconsciousness, limp body, choking, gurgling sounds, slow, shallow breathing, or blue around the lips and nail beds. Some of the side effects of Narcan are going to be nausea, vomiting, tachycardia, hypertension, withdrawal, anger, tremors, dysrhythmias, and seizures. I know one thing that's been very prevalent to us, has been pushed over and over and over again, is if you give too much Narcan, you're going to throw your patient into withdrawal, and they're going to basically wake up mad, angry, and you're going to have a harder situation than what you would have had before. You just want to make sure they're able to maintain their own airway. The last slide here is just a little bit of intervention help. Um, Figured I'd throw that in there. It's becoming more and more prevalent in our society. People struggling. A lot of middle-aged women, moms, dads. It's everywhere. So there's that. If anybody knows anybody, or just write it down. You might need it in the future sometime. But again, my drug was Narcan, and I appreciate you guys watching my presentation. Thank you. Have a good night.